Hi, I'm Dr. Jeff Reiswig, and I would just like to explain to you the basic dental examination and evaluation of your horse, and go through kind of the procedure step by step, what you can expect when you come and visit us. First of all, we would bring your horse into a stock and sedate your horse with a combination of medications that would keep the animal calm through the procedure. Then we use a mouth speculum. This is a dental mouth speculum that we place in the horse's mouth. There are several examination tools that we use. One is very similar to what you would find in your own dentist's office, the dental mirror, except perhaps a little bit longer. Additionally, we would use various probes and picks in order to evaluate the individual horse's teeth. And this is just one of the examples of the dental picks that we might need to use during that examination procedure. We take a look at each individual tooth and make sure we look at any sort of dental occlusion problems as far as waves and ramps and hooks, and take care of all the sharp points that we would find in the occlusal surface or along the sides. Thanks. After the dental examination and evaluation, we would start the floating procedure. And floating is basically the filing down of the sharp points that horses form on their teeth due to the constant wear. Historically, we have used hand floats to take these sharp points down. Let me show you a couple of these hand floats. This is a float that will cut when you pull it towards you. This straight float is typically used on the large portion of the arcade and the lower and upper cheek teeth. To do the first 2 or 3 cheek teeth on the upper side, we can use another pull float that's angled backwards at a certain incline to help us get maximum effectiveness on those first 2 cheek teeth on the upper side. And then to get the very back molars on the upper side and on the lower side, we have to use an angled float that's angled in about 15 degrees. The fourth float that we would use is the push float, and this one actually is the one that cuts when you push away from you, and it actually is intended to reduce the first premolars on the upper and lower side to establish a good bit seat. And the bit seat is the area of the first cheek tooth near where the bit would sit when you're riding the horse. And we want to make that area very comfortable so that no soft tissue is pulled into a sharp point and cause the horse pain during riding. What I tend to use most is now the power float. It's hooked to a drill, a long shaft that has a clutch in it, so if the horse bites down on it, it will stop. It's a safety procedure. And it's just hooked to a regular drill. And then back at the tip, there's a diamond carbide chip blade that actually turns and takes down the hook or the ramp or any of the sharp points. And it's guarded on the outside to protect any soft tissues in the gums and the lips. The dental evaluation examination procedure in floating and the correction of malocclusions is very important for any horse that you're going to ride. Anything that you're going to put in this horse's mouth, we need to be as good stewards of that animal. We need to be taking care of it and making it as comfortable as possible. In addition, solving any malocclusions in the horse's mouth will aid in the chewing and the digestion of the forages that the horse eats, the hay and the grain and the grasses that it relies on in order to have proper nutrition. It's important for the horse to chew efficiently because he only gets one pass at this. Every piece of hay or grass has to be broken down. That cell has to be broken open so that when it gets to the gut of the horse, and the microbes and the protozoa and the yeast start digesting those products, the only way it can get in there is if those cells are broken. So you can't have any malocclusions or any problems chewing, or the whole system doesn't work. It's the first step in the digestive and nutritional health of the horse.